Not at all. It seems to me that this is a very kind of knee-jerk reaction that Sajid Javid has taken, because he thinks that by some alchemy, if you're double jabbed, you somehow will not be putting anybody in danger in a care home. But he's not really right about that, is he?
No, he's not right. It doesn't make any sense whatsoever, especially when you factor in the fact that, we're telling people that there's a crisis in the care sector, yet at the same time, we're fully prepared to get rid of around 60,000 people. How does that make sense? And let's look at the topic of vaccination. As far as I'm aware, 89% of care workers are vaccinated. And even if they weren't, the vaccine is designed to protect you. So if an elderly person has the vaccine, they are protected from hospitalization or death. The vaccine does not stop you from passing it on. Actually, you are, the same level of, you have the same ability of being able to pass it on as that of an unvaccinated person if you have COVID.
Right.
So therefore, this really doesn't make any sense whatsoever. It's a draconian, authoritarian and divisive measure. And the reason why they're doing it is to coerce people. I really don't think this is about health at all, because if you cared about health, you wouldn't be threatening to sack people when there's a crisis in the sector.
Well, that's right, because as you say, there is a crisis in the sector. There's already people who have left the care home sector for all sorts of reasons. And so all that's going to happen here, if 60,000 people walk away from it, is care homes will close down. Elderly people who should be in care homes will be kept in hospital or moved to hospital, because that'll be the only place they can go. And then there'll be more pressure on the hospitals.
Exactly. And I find it amusing that the government have decided to mandate it for NHS workers April 2022, but for care workers, it's this week.
Right.
And one of the reasons that they've done that is because they don't want to create shortages during the winter period. Why can't the same apply to care homes, especially in the context of the care homes scandal that we witnessed at the start of this pandemic, where the elderly were basically being put back into care homes without any due testing, which led to massive outbreaks and mass deaths? This doesn't make any sense at all. And this is very, very scary, because in this country, we don't force people to get vaccines. The liberty of non-vaccination has been a legal principle in this country for hundreds of years. And there's a brilliant British medical journal article about this. And it even breaks a number of international conventions. For example, the Convention of the Council of Europe, which denounces discrimination and coercion on the basis of someone's health status, which the UK was a founding member of. So this goes against all of our values. And what do we seem to be doing this for? For hysteria? Because the media demands the government does this? Why? It doesn't make any sense to me.
It doesn't. I mean, I've seen some people make the argument that, well, if I've got an elderly relative in a care home, I would want the person looking after them to be vaccinated. But because of all the things you've said and because of what we know, it shouldn't actually make any difference. And apparently you can visit care homes if you've got a relative there without being double vaccinated. They don't make you show that you've been double vaccinated to get in. You can take a test, which is what all these people have offered to do, but apparently that's not good enough.
Exactly. And, are we going to talk about natural immunity? People working in these sectors, whether it be, the NHS on the front line or in the care sector, there will be very, very high levels, probably higher than that of the general population, of natural immunity. And we know that various studies suggest that natural immunity is actually more effective against variants and actually lasts longer than the vaccine. That's not to say that, the vaccine doesn't help the elderly and the vulnerable when it comes to hospitalization and death. But people working in those sectors at the moment will have a high level of natural immunity. Therefore, they will not be a risk to anyone. Yet the government doesn't seem to want to take this into account. It's complete hysteria, and I think it's a very, very wrong move.
Yeah, I think so too. And do you think people who aren't now vaccinated, if there are, as you say, quite a large number of them, 89% vaccinated, about 90-odd% in the NHS, the people who are not vaccinated are not going to get vaccinated suddenly, are they? They're not going to go, oh, all right then, I'll just get around to it. These are not people who haven't got round to it. These are people who have a reason for not wanting it.
Yeah, they have a reason for not wanting it. And, as numerous international convention states and even legal principles in this country, people have a right not to get a vaccine. You don't have to agree with it. You don't have to disagree with it. It's none of your business, quite frankly, whether or not someone chooses to undergo a medical procedure. That is their choice, and that choice should be respected, because that's how a civilized society operates, something that we seem to have forgotten.
Well, that's right. And do you suspect as well that the NHS manoeuvre, because they don't want them to be leaving, I suppose, the NHS before the winter, is a bit even more cynical than the care home one? Because I'm wondering if they'll even ever get around to getting rid of. They can't really afford to lose 100,000 NHS workers.
Exactly. We're constantly being told that there's a crisis in the NHS, that there's not enough staff, that this winter is going to be absolutely terrible. Yet at the same time, they're fully prepared to get rid of thousands of staff. But, I don't even think this makes sense with regards to pushing the mandate further down the line for NHS workers, yet mandating them this week for care home staff, because there's been a crisis in care homes in terms of staff for years. Even before the pandemic, it was just exacerbated by the pandemic. So if anything, you could say that's even less of a reason to mandate vaccines for care workers when you know that tens of thousands will be sacked.
Yes. I mean, I wonder if they're thinking by April it might have all kind of calmed down a bit, and the threat of doing it would have been enough for them. And actually, once we get to April, they won't bother doing it after all.
I think that's a really good point, because if you think about it, by April 2022, COVID will be even more in the background than it already is. I mean, right now it has a case fatality rate comparable to flu. So perhaps there will not actually be a real need for NHS workers to have the vaccine, especially considering they have higher levels of natural immunity and pre-immunity than that of the general population, as various studies attest. So this is probably a bit of a political manoeuvre by the government, definitely. I think that's a good point.
Yeah, I mean, interestingly, I got a text here from somebody who says, I've got no sympathy for people who won't take the vaccine. I bet if she wanted to go on holiday, she'd take it quickly enough. It's madness not to get it so we can wipe this virus out. Now, there's a lot of people with that attitude, Dominic, and in my view, they've been kind of convinced of that point of view by this government and its propaganda.
Yeah, do you know, at this point, I can't even really blame people for saying things like this, because it's what they're continually being told. They're told that people who choose not to get the vaccine, regardless of whether or not they've been infected or have pre-immunity, are selfish pariahs and they're disease spreaders that are very, very irresponsible, when the fact of the matter is, vaccines in terms of transmission have not wiped this virus out. It doesn't stop you from catching COVID or passing it on. In countries where there are extremely high levels of vaccination, there are still record levels of cases. Look at Germany, look at Iceland, look at Waterford in Ireland, where 99.7% of their adult population is vaccinated, yet they have some of the highest case rates in the whole of Ireland. The idea that vaccines wipe out COVID is a falsehood, unfortunately. Yes. And I think it's dangerous that this falsehood keeps being perpetuated.
Well, I mean, they said it was going to wipe it out when you got the first one. Then they said you needed a second one. Now they're saying you need a third one. I mean, how long before you're not fully vaccinated until you've had about 6?
Exactly, and they're doing this in Israel. They were saying that you won't be considered fully vaccinated anymore unless you get the booster. There's even been talks of the government mandating the booster for international travel. If the government can continually play with people's lives like this, at what point are people going to say no? With a fatality rate comparable to flu, we should not be discriminating against people and removing their livelihoods just because they won't undergo a medical procedure that they likely will not need if they're not vulnerable and if they've had COVID before.
I'm very surprised that what's going on in America at the moment. I don't know if you're aware that an awful lot of places over there are demanding people be double vaccinated. There's a big row going on, I think, at the moment in New York City, where the bin men, the dustbin collectors, have been told that they can't work anymore unless they're double vaccinated. And an awful lot of big American companies are demanding it as well. And I'm astonished that so many people are going along with it.
Yeah, it is mostly Democrat-run states, unsurprisingly, that are going through these draconian measures, very reflective of Joe Biden's authoritarian and just factually incorrect at many points takes on this whole COVID situation. I think it's absolutely disgusting, and it's surprising that those within the United States of America are doing this, considering, how their constitution pushes the idea of liberty, the idea of freedom, pushing against government tyranny, yet people seem so free to do this, free to discriminate against people. But what I think has been quite interesting about America, you've seen, states like Texas, you've seen Florida that actually made mask mandates illegal.
Yeah.
This is, I think, why sort of the American system is quite a good thing, because states like Florida have been able to say, wait a minute, no, we're going to create our own little haven of freedom here. We're not going to listen to the COVID hysterics. And at many points, they've been proven right due to the fact that they have, the lowest case rate, one of the lowest case rates in the United States at the moment.
Yes, that's true. And in fact, there's absolutely no reason to suspect that by not doing all of the restrictions, that they did the wrong thing. Because it looks to me like if you look around the world, no matter what anybody did, it all kind of comes out in the wash. It all looks about the same, doesn't it?
Exactly. That is so true. I mean, look at Germany. We were pointing to them saying, oh, they did so well with their restrictions. Look at their case rates right now. They're worried right now, despite the fact that they had draconian lockdowns and early border closures or whatever. Look at Sweden. Sweden has fared better overall than a lot of the other countries that locked down. And even look at this country. Cases have been continually dropping week on week, despite the fact that we have no restrictions, really, and no COVID passports. The idea that, the evidence that we've seen right now is an example of why we need lockdowns just doesn't actually match up with reality when you look at all of the examples around the world.
No, it really doesn't. And I've got some good news, at least for Louise Akester. I've had a text here from Mark who says, Mike, where is Louise based? I own a national FM company and ask Louise to contact me. I'll see if I can give her a job. This is disgusting. I'm a Tory voter, but not for much longer. And a lot of people who are traditional Tories are not happy with this government, not happy with Boris Johnson's green agenda, not happy with all of these restrictions they keep bringing in. Where's it all going to end, do you think, Dominic?
Well, I'm very worried about this. I'm very worried about the state of our democracy because of the way this government has behaved. It got an 8-seat majority, was elected, on the premise of Brexit, which is fair enough. I voted for Boris Johnson for that reason. But then we've seen them completely pivot away from what it means to really be conservative. Yeah. They're locking people in their homes, ripping up the whole idea of freedom and individual choice that many conservatives love to talk about. And then at the same time, they're pursuing sort of a left-wing green agenda that will see poorer people pay the price, preaching about the climate whilst they're flying around on private jets. It's completely disgusting. But the issue is we have an opposition at the moment that doesn't really seem to disagree very heavily with the government on many things. And internally within their own party, the Labour Party, it's a mess. So what many voters are saying is what's the alternative? I have to vote Conservative because there's nowhere else for me to go. Personally, I completely disagree with this. I'll never be voting Conservative again, quite frankly. If that means Labour gets in, so be it. But I think people should be voting en masse for the parties that match their conscience. And for me personally, the Conservative Party doesn't do it anymore.
No, I think you speak for an awful lot of people. Dominic, thanks very much indeed. Dominic Samuels there, commentator and broadcaster